Yesterday, I contacted President-elect Biden and his transition team to lay out our most urgent priorities, most importantly, the desperate need for a stimulus relief package for small businesses and struggling families. Every day I hear from small business owners who say that without this help, they may not be able to keep their doors open through the end of the year. PPP funding already ran out many months ago, and CARES Act funding will run out at the end of this month. And my message to everyone in Congress on both sides of the aisle is absolutely clear. If you do nothing else, if you pass no other legislation, and you can only accomplish one thing during this lame duck session, it must be to pass the Phase 4 relief package. We simply cannot wait until January 20th for this urgently needed relief. The time for partisan politics is over. We've been pushing for this for 8 long months, and the time has come to stop the partisan bickering, to reach a common sense compromise, and to get this done once and for all for the American people. Yesterday I had a meeting with Vice President Pence, the White House Coronavirus Task Force, General Perna of Operation Warp Speed, regarding vaccine production and distribution. Yesterday, we also held a meeting of the Maryland Coronavirus Task Force, along with many of the CEOs of our hospital systems across the state. And we had a discussion with the leadership of the Maryland Association of Counties and the Maryland Municipal League as we continue our outreach and communication efforts with local leaders across the state. This morning we convened our Unified Command Task Force as we constantly monitor all of the public health metrics in Maryland, as well as the spiking numbers in states across the country. As of this morning, Maryland has surpassed 201,135 confirmed cases of COVID-19, including an additional 2,765 cases in the past 24 hours. We have now had 27 straight days with more than 1,000 new cases. There were over 157,000 new cases yesterday in the U.S., the 28th straight day that new cases topped the 100,000 mark. Maryland's 7-day positivity rate is 7.33%. Our cases per 100,000 is now at 34.4. We continue to be in better shape than most of the nation. Our statewide positivity rate is better than 41 other states. Our cases per 100,000 is better than 39 other states. According to travelers, we're the 14th best state for residents voluntarily choosing not to travel out of state. And a Carnegie Mellon study just showed mask-wearing compliance in the state of Maryland at 96%. We are concerned, however, that our COVID hospitalizations have increased by 51% over the past 2 weeks. According to our modeling, we can expect to reach a new record high for hospitalizations in the coming days. 130 surge beds are currently in use at the Baltimore Convention Center, the reopened Laurel Hospital, and the Washington at Venice expansion, all of which we added this spring. 1,583 COVID patients are currently hospitalized in Maryland today, which is the highest level since May 10th. And 350 Marylanders are currently in intensive care units. 21 hospitals in Maryland have reached more than 90% of their capacity. COVID-19 hospitalizations in the U.S. have surged to their highest level ever, with over 96,000 Americans hospitalized today. As more and more hospitals across the nation are reaching their capacity limits, the virus has taken the lives of over 268,000 Americans, including 4,516 Marylanders. Sadly, we have lost our youngest victim, a 1-year-old boy, to this deadly virus. We are laser focused on taking actions in an effort to prevent the overburdening of our healthcare system. When we were dealing with the initial surge of COVID-19 in the spring, we added 6,000 additional hospital bed surge capacity. And we took a number of steps to increase staffing capabilities. I issued an executive order to fast-track the licensing process for out-of-state healthcare practitioners and those with an expired medical license, and an order to provide broader authority to credential emergency medical technicians and paramedics so that they could work in clinics and field hospitals. We activated the Maryland Medical Reserve Corps, a force of thousands of dedicated and trained medical and healthcare professionals ready to assist in a public health emergency. The Maryland Institute for Emergency Medical Services also instituted a program to allow medical students, nursing students, and medical technician students from our universities and colleges and community colleges part of this staffing surge capacity. Last month, we increased the capacity of alternate care sites and provided additional clinical care and staffing support to nursing homes dealing with outbreaks. We issued an order which limited hospital visitation and gave guidance to hospitals and other medical facilities on elective procedure admissions that are not urgent or life-saving, as well as an emergency order allowing hospitals that are either at or nearing capacity limits to transfer patients to hospitals which are more able to provide them with the care that they need. The current surge is not only increasing the burden on our healthcare system and filling available hospital beds, but it is also affecting our healthcare workers who are already spread thin and operating under immense strain and stress. Today, in partnership with the Maryland Hospital Association and hospitals across the state, we are taking a series of additional actions to further mobilize additional medical staffing to battle this COVID-19 surge. We're currently in need of people with clinical backgrounds to work at our hospitals, nursing homes, testing sites, and vaccination clinics across the state. Anyone interested in serving can go to www.marylandmednow.com. We are also contacting those individuals who have signed up for the Maryland Medical Reserve Corps. We're also requesting that all Maryland universities and colleges immediately develop emergency policies and procedures which will award academic credit to students who are willing to serve in healthcare during this pandemic. And we are encouraging our colleges and universities to allow healthcare students who are in their final semester and have satisfied all graduation requirements to be eligible for early exit and expedited testing and licensing requirements in order to more expeditiously enter the workforce. We're also urging our counties to tap all non-deployed school nurses, health services staff, and other county employees to help staff our testing and vaccination sites. And we are urging hospitals and nursing homes to begin utilizing unlicensed individuals to perform certain less critical tasks in order to free up nursing staff. In consultation with the doctors on our coronavirus task force and the CEOs of Maryland hospitals, we're taking these steps to ensure that every single Marylander in need of a hospital bed is able to get a hospital bed. Effective immediately, hospitals are also required to submit a surge plan, which includes detailed strategies for the expansion of hospital bed and staffing capacity adjustments. These plans must be submitted to the Maryland Department of Health no later than December 8th. Hospitals should begin making adjustments on an emergency basis, including adding or redeploying staff, reducing non-critical elective procedures, particularly those that require a bed or a ventilator, and transferring patients to other appropriate treatment facilities. We currently have 6,816 Marylanders in our state hospitals. When we reach the 8,000 total hospitalizations statewide, all hospitals will be required to expand their staffed bed capacity by at least 10% within 7 days of that trigger. The Health Services Cost Review Commission is reinstating emergency policies to provide more financial stability to hospitals as they navigate this pandemic. Now, after 40 years of incredible service to the state of Maryland in many capacities, in the House of Delegates and the State Senate as Anne Arundel County Executive, and serving for the past 6 years in our administration, Secretary Bobby Neal's retirement is effective today. He has been a longtime friend, a trusted advisor and confidant, and a dedicated public servant throughout his nearly 4 decades in public service. Most importantly, as we went to war against this unprecedented, deadly pandemic, we're incredibly grateful to him for his service, and we wish him the very best in his retirement. So if you'll indulge me, I'd like to present a governor's citation on behalf of a grateful state and the people of Maryland, just to thank him for his many years of service. Thank you. Stepping into his shoes immediately as the acting secretary of the Maryland Department of Health will be the department's chief operating officer, Dennis Schrader. Dennis has also been a longtime friend and a dedicated public servant who's also been a part of our administration for 6 years, most recently running point on our testing and hospital surge efforts during the COVID-19 pandemic. Our acting Deputy Secretary for Public Health Services, Dr. Jinlin Chan, will be leading our COVID-19 vaccine acquisition and distribution efforts. And Dr. David Marcosi, who has served on our coronavirus task force and has been the COVID-19 incident commander for University of Maryland Medical System, will, effective immediately, serve as our senior medical advisor on COVID-19. We're very fortunate to have him playing a more prominent role on our team as we face the challenging weeks and months ahead. I'm really proud of this incredibly capable and talented team and all the people that work under them. They will be playing a key role in guiding us through this critical and hopefully final phase of this pandemic response. So at this time, I'm going to turn it over to Dr. Marcosi to provide some further details on medical staffing surge.
Thank you, Governor. Good afternoon. It's a great honor to speak to you again today. At the start of November, it was obvious that we were entering a period of high risk, with the potential for peaks and mountains of new cases and illnesses. Unfortunately, the data confirms this and shows that more of us are being infected by this virus, more of us are transmitting it, and more of us are becoming ill because of it. Due to the rising numbers of cases and the recent holidays, I am very concerned that these next few weeks and months will be challenging as a result of continued and likely accelerated spread of this virus due to Thanksgiving. I do understand. We all just want to take one day off from COVID-19, especially during the holidays. Unfortunately, the virus doesn't take a day off. We know that millions of Marylanders did the right thing over Thanksgiving. They stayed home. They gathered with only their household contacts and avoided risky activities. To them, thank you. You have helped make a difference. Please keep it up. It's easy to just think about the impact of this virus as something abstract or inconvenient that will run its course, like a few bad weeks of winter weather. But let me be clear. There is no ceiling to this, or at least one we do not want to test. In other words, cases, hospitalizations, and deaths will continue to rise unless we take it on. Our actions, what we do as individuals, will stop the rising case counts and slow the spread. We did it before, and we can do it again. In fact, earlier today, I had the privilege of speaking with leaders and parishioners at the Calvary Baptist Church in Baltimore, who are thinking through the impact of this virus and how best to protect themselves and others during this high-risk time. They are figuring out how to fight back, and so should all of us. I have spoken before on this and want to continue to emphasize the importance of seeing your doctor or nurse practitioner if needed. You don't want to survive this pandemic only to have your other medical conditions worsen. Many providers have the ability to see you either by phone, through a telemedicine application, or in their office safely. We all need to stay physically and mentally healthy, particularly during this holiday season. Call your doctor's office and make sure you maintain your health and have the prescriptions and treatments you need. Let me briefly tell you what it's like to work with the people I work with at the University of Maryland Medical System or at every other hospital across our state. Beds are filling up with significant numbers of patients, testing hospital surge plans and our healthcare heroes, the nurses, doctors, and other healthcare professionals who deliver that care in the most stressful environments. They persevere and are working extra shifts to carry the burden. That means potentially missing time at home during this holiday season. They do it for their patients. They do it to save lives. That said, those heroes are stretched thin, and we need to think innovatively on how to address potential staffing constraints. As the governor mentioned, I believe there are opportunities for students to get involved in the response, and colleges or other higher-level educational programs could and should investigate providing credits for their organizational participation in this response. For those dedicated healthcare providers, teachers, and other essential workers who are selflessly working to support patients in our communities, thank you. I'm an Army Reserve officer and reflect on one of the 7 Army Reserve values relevant to all of us in this response so that we can keep those essential workers protected. It is the concept of respect. The Army value for respect states, treat people as they should be treated. And in the soldier's creed, treat others with dignity and respect while expecting others to do the same. It is simple. Wearing a mask is a sign of respect. Let's make it our normal. This simple thing that we wear over our nose and mouth limits the spread of our common silent enemy, and it helps protect each other. To get through this, no question about it, it will require courage. Courage to work together, courage to keep going, courage to address healthcare disparities, courage to ensure that data and science drive our decisions. Marylanders, we need to get our second wind. We need to double our efforts right now to get more of us through this healthy. If we do that, we will not only maintain our health, but also maintain our economy. I was reminded today that this holiday season's theme is hope. we should have hope. We know how to fight back against this virus, and there are safe vaccines on the way, very effective vaccines. When it is available to you, go and get one. When it's my turn, I will, without hesitation or doubt. I have every confidence in the process, and I believe that its safety and efficacy will be proven and well documented. Vaccines are the very best tool we have for getting back to normal. Our unity is our strength. We were successful in fighting back against this pandemic once before, and we can do it again. Yes, we're tired, but we're also battle-tested. We know what to expect, and we're ready for it. Let's find our second wind. Let's be smart, show respect, stay healthy. And to partially quote our governor, just wear the mask. Thank you.
Doesn't quite have the same impact, but thank you, Doctor. Any questions? Tom?
Governor, obviously these are very troubling details you've just discussed. Why not announce more restrictions today, and could you walk us through the process of what could be next if this trend continues?
Well, we're taking decisions as we think they're necessary. So today we're focused on what we do about the fact that our hospitals have too many people in them. We've taken an awful lot of actions on trying to restrict the virus, and we're going to continue to look at things as they become necessary. But the current focus today is on our healthcare providers and our hospitals and those people that are in the hospital, and we're trying to keep alive.
Question for Dr. Marcos. Dr. you mentioned a plea asking for colleges to see students can help out. Do you have maybe a couple of ideas on what the students could do to help out?
Yeah, this is certainly not just a question for me, but also for the governor. So I'll at least start. I think there's a great opportunity to involve students in the response. Students who are particularly health science students, who are partially trained and understand some antiseptic techniques, how to put a shot in someone's arm, vaccinate, how to test for, how to collect samples for testing. There's great opportunity there for colleges and universities to think through collectively how to make sure students are brought into the response.
Yeah, good answer. It's just an extender for our, more highly skilled medical professionals, because if you have somebody at the lowest level that is able to, as he said, give a shot, do a swab, work at the testing facilities, or do other things that you need to keep patients comfortable, then the nurses who are more highly skilled can focus on the patients that need their help the most, and the doctors can spend more time with the patients.
Governor, I know that in 10 minutes the CDC will be voting on their allocation plan for the first batch of vaccine, but I'm curious, in Maryland's draft plan, phase 1 or phase 1A and B, how many doses of the vaccine do you believe Maryland needs to carry out the plan as is, and how many have the feds indicated you'll get? I know this week Mayor Bowser said she only expects to get 10% of what the district needs. Can you give us an idea for our state?
But the whole country is only going to get a small percentage of what we need, because there aren't enough in production yet. So I believe, and Dr. Chan can correct me if I'm wrong, we just got this information, I think, this afternoon before the announcement. So our first batch is going to total about 155,000, I think, which is 50,000 some change from Pfizer, and the remaining number from Moderna. And that's a tiny fraction of what we need. It doesn't even it covers half of our frontline healthcare workers. It doesn't get to anywhere near what we need in phase 1. That's the bad. The good news is they have great vaccines, and they're years ahead of schedule, and we're going to get some relatively fast. The bad news is it's not enough, and so we have very difficult decisions, which we'll be getting more into in probably our next press conference, about the implementation and rollout of that plan as things ramp up. The good news in our discussion yesterday with General Perna and Vice President Pence and Dr. Birx and Dr. Fauci and the whole team it's sort of like our testing when we started at 50 tests a day and then we got up to 50,000 tests a day now in some cases, that this is going to be a little bit of a slow takeoff as they get producing, and then hopefully we're really going to start to get some volume out. You know, that's what we're looking at.
A quick follow-up, because it is important. The 155, is that 155 of the 2 doses, or is that
Well,
155 divided by 2?
That was exactly the same question we had. So we're gonna hopefully give you more info on that in our next press conference.
Governor, you're clearly looking for additional help and medical personnel. What's the expected deficit, and how many people do you need to sort of fill that to get an adequate staffing level?
Well, that's, I mean, maybe one of the others could give you a more accurate, we don't know exactly how many we're going to need. We know we don't have enough. And, I mean, just think about it. If we're expecting to potentially get, you know, a couple thousand more people in the hospital in short order, I don't know how many staff you need to take care of a couple thousand extra people, but for 3 shifts a day with multiple people, it's thousands of people that we need to help.
Yeah, thanks, Governor. We're expecting initially, as the cases rise by 1,000 or 2,000, that we will need upwards of 2,000 to 3,000 people. So that's where we're making such a broad call, because people are under stress already, and so we're looking for probably 2,000 to 3,000 people to step into roles over the next several weeks.
Governor, I know you talked a lot about the metrics that you're looking at, tracking hospitalizations and other things very, very closely. But then every time we ask about what is this the moment when we bring in new restrictions, you sort of say, well, we're working on it day by day. We're looking at all these things, and we're going to do what we need to do. When would we need more restrictions?
Well, we just announced new restrictions last week, so it's not like we've been waiting. We've taken some pretty aggressive, probably the most aggressive actions of any state in the country, and we'll take them as we see fit, as we have been for the past 9 months.
So, Jordan, going back to the COVID relief, I know you're pushing for that. I wanted to get your thoughts on the plan coming out today from some lawmakers, $908 million. Do you think
Say that again. I'm sorry, I didn't hear what you were talking about. The mask and my hearing, and you're far away. And
$908 billion for the COVID relief plan coming out from some lawmakers in Washington today? It doesn't have any money for families, but I wanted to get your thoughts on that. Do you think that's enough?
Yeah, no, it's not enough. You know, I was pushing for this since going back to March, which is the last time the thing got through. We're pushing for a lot more. Right now, my main focus, because the CARES Act money is about to expire, and that businesses and individuals are really suffering, and there's not enough money out there, and in addition to state and local governments running out of money, that we need to help. And while, yes, we need more, it's like we need more vaccines and we need more relief money, but we'll take what we can get now. So having nothing done for 9 months is really frustrating. Getting some compromise for some amount of money right now rather than waiting until next year is probably a step in the right direction. So I've been in discussions with, I reached out to Vice President Biden, talked to Vice President Pence. I've been trading phone calls with a couple of the senators today that are part of that compromise to try to, weigh in and provide some input. It's discouraging. Secretary Mnuchin said they're not going to have a deal by the year end. Some senators are coming up with a much smaller package. So it's not enough, and I don't want to say, yeah, that'd be great, but it would be better than nothing. And my push is not for a specific amount or a specific bill or what the Democrats in the House want or what the Republicans in the Senate want. I just want people to get together and figure out some kind of a compromise.
Governor, has your office been in touch with Baltimore County in regards to the ransomware attack? And how concerned are you that this could happen to other school systems around the state?
Well, it's obviously a big concern. Yes, our administration has been assisting Baltimore County in an advisory capacity. The folks from DOIT, Department of Information Technology at the state. It's a serious issue. Obviously, they're taking point on their school system as the one dealing with the problem, but the state is trying to provide whatever input and advice we can. And it's obviously, a concern to other counties as well. I know this was something that they were working on trying to fix and didn't quite get it done in time, and hopefully some of our other counties are not in the same position, but it's certainly a threat.
Governor, the Florida Board has proposed a number of cuts to its budget that would affect ridership, and I wondered what your reaction is to that and how it might affect the economy, the region's economy.
Well, so Metro, like so many other things, is their revenues are down drastically because of lack of ridership. If you'll remember, I put together a interstate compact agreement with Virginia and DC on saving the Metro system 2 years ago and coming up with a funding source to keep it afloat. But my push that wasn't successful was to get the federal government to pay their fair share, because most people that ride Metro are federal employees, the majority of them, and they don't contribute. And I was trying to get them to kick in. So one thing I'm going to do now with the incoming administration, the first chance I get, the day they name a transportation secretary, my first call is going to be saying, we need your help on Metro, which I tried to do with the current administration unsuccessfully, and then Maryland, DC, and Virginia had to foot the whole massive shortfall. So it's a mess, and we're going to need some help from the federal government.
Governor, speaking of transportation, the $250 million settlement on the Purple Line, where's that money coming from?
It's going to come out of the, I think, revenues for throughout the course of the project. It's just a different split.
Governor, back to the COVID and the hospitalizations. You alluded to it. It's only going to take 2 days to pass 1,700 if the current rates continue. The hospitalization model has 4,000 total hospitalizations. I called around to a number of hospital organizations today. They say so far they're handling it. What is your fear a month from now? How bad will it get? I mean, you're trying to make an impression on the community about masks and the whole thing.
Well, yesterday we had a very kind of interesting and frank discussion with most of the top hospital CEOs, along with all of our kind of public health experts and the people doing the modeling. And it's a scary situation for everybody involved. I mean, our modeling has been pretty much on track. We do see in the next few days us hitting a critical point. We think it's going to continue to get worse over the next at least several weeks. And as Dr. Marcosi said, I mean, I believe most of the educated projections say that we are not near the peak yet, and that the worst part of this entire crisis is still ahead of us over the next month or two.
Governor, the CDC obviously had advised people not to travel over the Thanksgiving holiday, and many of our news organizations had reporters at the various transportation hubs, and people traveled in mass. What is your message to Marylanders who traveled over the holidays, went out of state, maybe defied some of this advice, and have now returned to the state of Maryland?
Well, so I mentioned earlier, a couple different groups have done studies on Maryland. 90% of Marylanders did not travel for the holidays, which is a record amount. So a lot of people were following the advice. Other people traveled, and we've said anyone who did travel should be tested, and they should take it seriously. I mean, I heard some of the folks in Washington, I think Dr. Birx was saying, if you traveled for the Thanksgiving holiday, you should assume that you're infected. I don't know if we should take it that far, but you should definitely get tested before you're around any vulnerable people.
Last question?
All right, that was the last question. Tom closed us out.